Welcome everyone. Today we shall see about pharmacodynamic agents. So, if we know about the term that is pharmacodynamic agents, those drugs which helps to treat the disorders related to normal physiological functions of our body, that is blood circulation, or it may be gastrointestinal problems, or it can include allergic problems also. So the drugs that can be advised or that can be treated or for such disorders in our normal physiological functions can be referred as pharmacodynamic agents. So under this pharmacodynamic agents, it can be further classified into 7 categories. The first one is anti-hypertensive agent. Second one is gastrointestinal agent. Third one is anti-arrhythmic drugs. Fourth one, vasodilators. Fifth one, anti-anginal drugs. Sixth one, anti-allergic agents. And seventh one, hematological agents. So let us see one by one. First one is anti-hypertensive agents. So first, we should know about hypertension. So normally, our blood pressure is maintained as 120/80, that is 120 systolic pressure and 80 diastolic pressure. So, but due to high intake of salt or fat or maybe cholesterol, this blood pressure will not be maintained to this normal level and it will be increasing. First it will be increasing milder, then slowly it will be reaching to stage 1 hypertension, that is the systolic pressure will be around 130 to 139 and diastolic pressure will be around 80 to 89. And then it will be reaching to the next stage, stage 2 hypertension, and finally it will lead to the most critical stage, that is 180/120 or above. So during this hypertension condition, due to this increased force of blood, the artery walls get eroded or destroyed, and slowly to this eroded artery wall there will be depositions of calcium or fat or cholesterol. It may be depositing over this eroded surface, and again this deposition can burst and there can be a blood clot formation. And this blood clot, when it blocks some valves or somewhere in the vascular system, that is when it is related to heart, it will result in heart attack, or when it blocks the blood flow to brain, it will result in stroke. So these drugs which helps to alleviate these problems, to overcome from these problems, to treat hypertension, can be referred as anti-hypertensive agents. So what is hypertensive agent? The drugs which help to treat this hypertension is called as anti-hypertensive agents. So we have to know another term here, atherosclerosis. That is, we have already seen that due to prolonged force exerted over the artery walls, the artery surface walls will be eroded or destroyed, and over this eroded layer there will be another coating deposition of calcium or fat or cholesterol struck into it, and this extra deposition over the walls leads to, or it can be called as, atherosclerosis. And because of this extra deposition, you can see in this picture here, this artery wall is being shrunk or constricted. Okay, and so this condition is called as atherosclerosis. That is, the pressure will be still increased, and there is a risk of blood clot formation too, and there may be heart attack or stroke, and it will be critical to our life. So these life-saving drugs, that is the drugs which helps to treat or control this hypertension, can be referred as anti-hypertensive agents. So the next category under this pharmacodynamic agent is gastrointestinal agent, and here also these drugs helps to cure all the intestinal related problems, that may be a peptic ulcer, or maybe a loss of appetite, or maybe vomiting, diarrhea, or it can be constipation, any problems that is related to intestine. So first one is peptic ulcer. Here you can see in this picture that because of excessive acid reflux in the stomach, the walls of the duodenum is getting eroded, and it is being inflamed, and there is bleeding can also be resulting. And this is an example for ulcer. Okay, and this ulcer can be due to our poor eating habits, or we may be having a regular habit of taking this packaged items, or etc. Because of this, there may be ulcer. And the drugs that helps to treat this ulcer are antacids. For example, this aluminum hydroxide, milk of magnesia, etc. All these antacids clears the extra acids in our stomach and helps to protect our stomach from these erosion from gastric acids. So next one is loss of appetite. Mostly for this loss of appetite, this bittery substances can be a good drug. These bitters will enhance salivation and will help for digestion of fatty substances. So our stomach will be freed off from complex substances, so that there can be appetite to be induced. So next one, vomiting, diarrhea, and that may be due to some food poisoning mostly. And for this also there are medicines. Drugs, apomorphine helps to clear vomiting, and bismuth subsalicylate helps to control diarrhea. And this diarrhea can also be due to the stimulation of autonomic nervous system that we have already seen. Okay, and then constipation may be due to some hormonal problems induced, or maybe due to mainly due to stress also, or maybe due to some other food habits also. So for this, castor oil can be used, and all these drugs that helps to treat gastrointestinal problems can be referred as gastrointestinal agent. So this gastrointestinal agents or drugs that helps to treat all the disorders that are related to our intestine. Okay, so the next one is anti-arrhythmic drugs. So from this term also we have to understand arrhythmic, that is related to our heart. We will be getting a lumped up sound from our heart, and this lumped up is referred as rhythm here. So any disturbance or abnormality in this lumped up rhythm can be referred as a rhythm. So here there are two types mentioned here, that is either this rhythm can be slowed down or it can be speeded up. So lower heartbeat can also be there, or the heartbeat will be exceeding. Okay, so normally our heartbeat will be in the range 60 to 100, that is around 80 beats per minute. It can be in between 60 and 100. So if this heartbeat is lowering below 60, that is referred as bradycardia. And the drugs are also there to increase this blood pressure, that is atropine can be given. And the next category here is tachycardia, that is heartbeat will be above 100, increased heartbeat, and this can be cured by using digitalis drugs. So here any disturbance in our heart rhythm is called as arrhythmias. Our heartbeat can be slowed down or can be speeded up. When it is slowed down, that is called as bradycardia, and when it is speeded, that particular condition is called as tachycardia. And the drugs that helps to treat any arrhythmias condition can be called as anti-arrhythmic drugs, that is drug that helps to normalize our heartbeat, that can be called as anti-arrhythmic drugs. Okay, so the next condition, it is vasodilators. And here in this picture you can see vasodilation, vasoconstriction. Vasodilation is having sufficient space or path for the vascular system. The vascular system will be broadened. Okay, and vasoconstriction is the path will be narrowed down, it will be shrinked, and the blood flow or the supply of oxygen or minerals through this blood will be very limited here under this vasoconstriction condition. So our heart has to be pumped up more, and this will result in blood pressure increase. Okay, so to reduce this blood pressure, we have to dilate our vascular system, that is we have to broaden our vascular system. Okay, and this you can see in the second picture. Here you can see the animation here. The vascular system or the blood vessels are being dilated to enhance blood flow, so that our heart blood pressure, that is our blood pressure, can be normalized. So the drugs that are helpful to treat such problems, that are helpful to dilate our vascular systems so that to maintain our normal blood pressure, can be referred as vasodilators. We can repeat, that is vasodilators or drugs that helps to dilate our vascular system so that the blood flow can be free and so that the blood pressure can be minimized. That is referred as vasodilators, and these drugs can be referred as vasodilator drugs, nitroglycerin, captopril, etc. And the next category is anti-anginal drugs. So first, let us see the term angina pectoris. Actually, this angina pectoris is not at all a disease. It is only a symptom that we are referring. That is, when we feel chest pain, that is referred as angina pectoris. And when we are having this particular chest pain, that is the imbalance between oxygen supply and oxygen demand to the heart. For example, if we are doing a heavy exercise, our muscles will be burning and it will be consuming more oxygen. Okay, so it will be burning for calories. Nutrients will be taken up. It will be requiring more oxygen for that. So our heart has to obtain more oxygen, but there will be a lapse in this. It may not contain more oxygen, and this difference in oxygen supply as well as the demand will cause a pain in the chest, and that is called as angina pectoris. And similar condition can also be seen when there is any blockings or depositions in the vascular system. Here you can see in this animation picture, that is some depositions over the eroded artery walls are seen, and because of this the path of this vascular system is narrowed down, and so the blood vessels is suffering to flow freely. Okay, and because of this there will be pain in the chest, and this condition is referred as angina pectoris. And the drugs that helps to clear or treat such symptoms can be referred as anti-anginal drugs. It can clear its symptoms, that is, it can clear the chest pain. And the drugs that helps to treat angina or the chest pain can be referred as anti-anginal drugs. Okay, for example, glyceryl trinitrate, amyl nitrate, these drugs helps to treat angina, and they are referred as anti-anginal drugs. So to repeat, so the drugs that helps to treat angina or the chest pain, or that is angina pectoris, which is a symptom due to imbalance between oxygen supply and oxygen demand in our heart, can be called as anti-anginal drugs. So the next category under this pharmacodynamic agent is anti-allergic agents. Mainly this allergy can be referred as hypersensitivity reaction towards foreign substance. Okay, mainly foreign substance will be a protein, and this foreign substance can be called as allergens, and this allergens can be a pollen from flower, or it can be any dust that is surrounding us, or any chillness, or it can be due to some chemicals that are present in fruits, vegetables, etc. Anything can be an allergen for a person. So this hypersensitivity reaction is due to the release of histamines from our basophils that is present in WBC. And because of this hypersensitivity or because of this histamine release, we are getting some allergic symptoms. It will think that some other foreign substances or some other infections that we are getting. So, as part of its work, it will be stimulating histamine production. Basophils of this WBC will secrete histamines, okay, to control this infection. And this allergic symptoms can be any one of these. That is, tears can be from eyes, or eyes can be reddened, or we can get a runny nose, or cough, or vomiting, or this face will be swollen, that is edema, or any rashes can be occurring on our skin, or our skin can be reddened, or we'll be having sneezing, anything, okay. And these allergic symptoms are due to hypersensitivity to the foreign substances, especially proteins. And this is due to the release of histamines from our basophils in WBC to protect us, okay. And these drugs, cetirizine or diphenhydramine, can be advised to control this allergic symptoms. It will be acting as antihistamines. It will control the release of histamines. Okay, so the drugs that helps to treat allergic symptoms can be called as anti-allergic agents. Okay, so allergy is nothing but hypersensitivity reaction towards foreign substance, that is due to the release of histamines from basophils of WBC in part of its protection work against foreign substances or foreign infections. So these drugs, what will they do? They will just control the release of this histamines, and so it will treat the allergic symptoms. And these drugs which helps to treat the allergic symptoms can be referred as anti-allergic agents. So the last category is hematological agents. From the name itself, we could able to understand hema, that is the disorders related to our blood. That may be anemia, or that may be the ability to coagulate more, that may be resulting in blood clots anywhere in between, or it may not be able to coagulate properly. Okay, so blood disorders such as anemia, not able to coagulate, that will result in bleeding, more bleeding, loss of blood, and that will be fatal to our life. And the next problem, it will be coagulating more due to the imbalanced effect of hormones. It will be coagulating more. If it is coagulating more, there will be blood clot formation within, and that may result in heart attacks, strokes, and such problems. So for anemia, to clear anemia, there are also a number of types. You can see in this picture, that is microcytic, macrocytic, and hypochromic also. Microcytic means, from the word itself, micro, small, cytic, cell. Okay, this RBC will be smaller in size. Okay, RBCs will be smaller here. So the next one, the RBC counts will be lesser. And the next one, macrocytic, means the RBCs will be larger in size. Okay, cells will be larger, and sufficient RBCs will not be present. And hypochromic, hypo means less, chroma means color. The color of RBC will be pale, that is due to lesser hemoglobin, that is the coloring pigment. The red color in blood is given by this hemoglobin pigment, and because of this shortage of this hemoglobin pigment, it will not be darker in color, it will be somewhat pale, that is hypochromic, due to deficiency in hemoglobin, that is the hypochromic condition. So microcytic hypochromic anemia means, again, HBs will also be less and RBC count will also be less. Okay, hemoglobin count less, RBC count less, smaller in size RBCs. So such type of anemias can be cured by giving iron tablets or citric acid. Vitamin C is helpful in absorption of iron. So vitamin C tablets can be advised, and mainly for this macrocytic or megaloblastic anemia. Macrocytic anemia can be otherwise called as megaloblastic anemia, and for this vitamin B12 or folic acid tablets can be advised. Okay, so next, anticoagulants. Okay, so if our blood is coagulating to a greater extent, that is, it is not thinned, okay, it is not able to flow freely, so we can advise this heparin. Okay, this is an anticoagulant agent, and this heparin helps to thin out our blood. Okay, and if it is coagulating, if it is not coagulating, that is, if we are having a cut or if we are met with accidents, the blood will be continuously losing out if coagulation process is not normal, that is, our fibrin thrombin is not functioning normally, means blood will be flowing out freely and there won't be coagulation. Okay, so there will be loss of blood, and to control this condition, this thrombin, fibrin can be act as drugs. Okay, so anticoagulants heparin, and coagulants fibrin and thrombin. This thrombin will be forming a mesh over this infected part, and it will be controlling excessive bleeding. Further, the blood bleeding will be arrested by the mesh it will be forming over the layer. Okay, in such drugs, in vitamin C, vitamin B12, then folic acid, heparin, in these drugs will be called as hematological agents that are helpful to treat blood related disorders. Okay, so what are hematological agents? Those drugs that helps to treat blood related disorders such like anemia or the inability to coagulate or its greater extent to coagulate such that it is forming blood clots also. And such conditions could be treated by this hematological agents. It is agents or drugs that helps to clear this blood related disorders can be called as hematological agents. So to conclude, so totally 7 categories under pharmacodynamic agents, that is those drugs that helps to treat abnormalities in our normal physiological functions. That is, first one is anti-hypertensive agent, second one gastrointestinal agent, third one anti-arrhythmic drugs, and fourth one vasodilator drugs, fifth one anti-anginal drugs, sixth one anti-allergic agents, and the last one hematological agents. That is, anti-hypertensive agent means those drugs that helps to treat hypertension that may otherwise lead to heart attack or stroke that is induced by this atherosclerosis. This aldomet chloride drugs which helps to treat this hypertension can be called as antihypertensive agents. And the next one, gastrointestinal agent, those drugs that helps to treat or control intestine related problems, gastrointestinal problems such like Peptic ulcer, vomiting, diarrhea, or loss of appetite, etc., can be called as gastrointestinal agents or anti-ulcer drugs. And the next one, anti-arrhythmic drugs, that is those drugs that helps to treat the abnormality in our heart rhythm, that can be called as anti-arrhythmic drugs. Either it can slow down our tachycardia condition that is seen in this animation, or it can speeden up our bradycardia condition. So those drugs that helps to maintain the normal heart rhythm, freed of this bradycardia, tachycardia condition, can be called as antiarrhythmic drugs. And the next one, vasodilator drugs. So those drugs that dilates our vascular system so that it controls our blood pressure, can be called as vasodilators. And the next one, anti-anginal drugs, in those drugs that helps to treat angina, that is pain in chest, a symptom which is a symptom due to imbalance between oxygen supply as well as oxygen demand in our heart, and that are referred as anti-anginal drugs. And the next one, anti-allergic agents, in those agents or drugs that helps to control this histamine secretion, or that is responsible for this hypersensitivity allergic reactions in response to the foreign proteins, can be called as anti-allergic agents. And the last one, hematological agents, that is those drugs that helps to treat blood related disorders like anemia, or its inability to coagulate properly, or its excessive tendency to coagulate. And such problems can be treated using hematological agents. So that's all. Thank you.